Thyroid hormone inactivation in gastrointestinal stromal tumors by Gibson Zurita, Mr. Moscoso, fourth semester. Okay. Of a 51 years old man was found to have a large abdominal tumor during a left inguinal hernia repair, given the absence of disseminated disease, a partial gastrectomy and transverse colectomy with block resection of the primary tumor were performed with curative intent. Pathology examination led to the diagnosis of a GIST.
'GI stromal tumors, or GIST tumors, are a relatively rare neoplasm or tumor that can grow in your body. They can exist anywhere from your eating tube or your esophagus all the way down to your rectum. The most common place that these tumors can be found are in the stomach. There are about 5,000 to 6,000 new cases of these GIST tumors in the United States per year. Some tumors are more malignant than others, but all of the tumors have some sort of malignant potential or the potential to spread.
I had one surgery, and 2 weeks ago, I had two tumors.
2 years later, computed tomographic surveillance revealed live relations that were confirmed and biopsy as metastasis and GIST. This finding prompted the initiation of treatment with immediate methylate, which was discontinued after 10 months owing to disease progressing, and then Sarafeni, which was discontinued after 5 months owing to disease progression. 6 months after discontinuing Sarafeni, the patient was enrolled in a research trial of sunitine therapy, which at that time had not yet been approved as second-line therapy.
This patient is a 47-year-old male who presented with ulcer-like upper abdominal complaints. In the mid-antral region, an approximately 8 centimeter large oval smooth tumor is observed. There is clear ulceration on the top of the lesion, but no signs of recent hemorrhage. With the endoscope in the retroflexed position, a second larger ulcer can be observed. It is important to realize that such ulceration represents tumor necrosis and is no marker of malignant behavior. EU
Because of a thyroid dysfunction that is associated with the use of tyrosine kinase inhibitors is multifactorial and probably varies among individual patients. Previously discovered mechanisms include the thyroid toxicity owing to the reduced vascularity of the gland, 4 and 21, inhibitions of iodine uptake or organifications, 3 and 22, and the induction of hepatic D3, 4, and 23, and thus in most patients, tumoral D3 is only one of several mechanisms that can be to produce systemic hyperthyroidism. On the basis of our studies of isolated and GIST1 cells, physiology levels of thyroid hormone have nearly direct effects on GIST proliferation or viability. Um, so exogenous thyroid hormone should be administered as needed to restore authorities. If we have diagnosis or our patient's combustible hyperthyroidism, early his level time addicts that could have been aggressively increased to rapidity, correct his several hyperthyroidism and reverse its potentially the deleterious effects on cardiac functions and fluid balance. Monthly measurements of serum tyrotropin in a patient with a large the JST burden and symptom of hyperthyroidism. Even if thyroid kinase inhibitors have never been used, could avoid the complication of ocular hyperthyroidism and the risk of incurring attributing hyperthyroidism symptom to the cancer of the chemotherapy. Thanks for your attention.